what inspired us to do this study was based on previous reports that among patients who had ischemic stroke, Black and Hispanic people are less likely to be treated with thrombolytic treatment. And as you know, thrombolytic treatment is an evidence-based treatment that can improve the outcomes after stroke. So if Black and Hispanic patients are less likely to be treated, that may adversely affect their outcomes after stroke. But the previous study did not tell us whether the less treatment among Black and Hispanic patients are because of pre-hospital delay, meaning they did not arrive at the hospital within the 4.5 hours thrombolytic time window, or because the hospitals are not providing the treatment. So we used the guideline data, which we can group the patient based on their time of arrival and the treatment after hospital arrival. So that we think this is more informative in terms of our next step intervention, whether we should improve the community stroke readiness or improve hospital quality of care. So we studied the guideline stroke database from 2003 to 2021. And we found that among overall ischemic stroke patients, non-white patients, including Asian and Black and Hispanic patients, are less likely to arrive at the hospital within 4.5 hours. So in 2021, 55% of Asian and Black patients arrived at the hospital after 4.5 hours versus 48% in white patients. This is a big difference that means those people who did not arrive at the hospital within 4.5 hours will be excluded from the treatment. That's based on the eligibility of the medication. And for those who arrived within 4.5 hours, the unadjusted thrombolytic rates increased from 10 to 15% in 2003 to 43 to 46% in 2021 across all race and ethnic groups without significant disparities. But disparities emerged after adjusting for patient demographics and the stroke severity and comorbidities such as hypertension and diabetes, with Black, Hispanic, and Asian patients having lower odds of receiving thrombolytic treatment throughout the study period. And then we further studied the association of these treatment rate with Target Stroke National Quality Initiative. As you know, so Target Stroke was launched by the American Heart Association and the American Stroke Association. The phase 1 was launched in January 2010, and phase 2 was launched in January 2014, and phase 3 was launched in January 2019. With specific goals to achieve door-to-needle times. And why do we focus on door-to-needle times? Because door-to-needle times are under the control of our healthcare system and caregivers. And this is the most relevant care metrics for National Quality Initiative. And we have proved, in the previous studies, we have proved that faster door-to-needle times are associated with better functional outcomes after stroke. So we studied the door-to-needle time improvement across these 3 phases of target stroke national quality initiatives by each race and ethnicity. And among the patients who arrived within 4.5 hours, we found that the door-to-needle times were relatively unchanged through the 2003 to 2009, the pre-target stroke period, and improved substantially in all races and ethnicities during the target stroke time period. We have seen a substantial improvement in the treatment frequency and the speed of treatment in all race and ethnic groups, with more increase among non-white populations in each phase. But after adjusting for the patient and the hospital characteristics, we saw a residual disparity with Black, Asian, and Hispanic patients less likely to be treated with thrombolytic treatment and with longer door-to-needle times. So in conclusion, we found that target stroke was associated with continuous improvement in thrombolysis frequency, timeliness, and functional outcomes for all race and ethnicities who present to get with guideline stroke participating in hospital within 4.5 hours. But racial and ethnic disparities emerged after adjusting for patient and hospital characteristics, with Asian, Black, and Hispanic patients less likely to receive thrombolysis treatment or to be treated within the guideline recommended door-to-needle times.